Today we are going to see about pharynx. This is one of an important question. It can come as a long question or separately nasopharynx, oropharynx or laryngopharynx can come as short note questions. Okay. So let us see what we'll have to write under pharynx. Where is pharynx situated? It is situated behind the nasal cavities, mouth and larynx. That's why it is divided into the area which is behind the nasal cavity is called as nasopharynx. Behind the oral cavity is called as oropharynx. And behind the laryngopharynx is called as, behind the larynx is called as laryngopharynx. Okay. Let us see the picture. This is the pharynx area. Okay. This is the nose. Posterior to the nose, this area, whatever we can see, this is called as nasopharynx. The area which is behind the oral cavity is called as oropharynx. And the area which is behind the larynx, okay, this is the larynx, okay, behind the larynx, this area, what we can see is called as laryngopharynx. If you see pharynx, it is a enclosed space and it is collapsed. How are we looking at this picture? It is the picture where we had taken sagittal section of the cranial cavity, including head and neck. Okay, entire head and neck, we have taken a sagittal section and we are looking at one half of the pharynx, okay, from inside. So we can see that this is the pharyngeal region and we can see that it is broad at the upper end where roof is formed from the, at this region, okay. Roof is where is the roof present? It is present at the base of the skull, okay. We can see this is the base of the skull. We have studied the base of the skull where basi-occiput region is there. So basi-occiput region forms the roof of the pharynx. How pharynx continues? Pharynx continues in front of the cervical vertebrae and behind the nasal, oral and laryngeal cavities. And below it is continuous with what? Continues as esophagus. Okay. At which level? At the level of C6. From C6 onwards, the pharynx becomes esophagus, larynx becomes trachea from C6 onwards. Okay. So now let us see what are the features of the larynx in different regions. Let us look at nasopharynx. Okay, this is the nasopharynx. What is nasopharynx? The area of the pharynx which is in continuity with the nasal cavities. Behind the nasal cavity, this is what you are looking at, the lateral wall of the nose. Behind the nasal cavity, lateral wall of the nose, we can see various conchae present here. Behind the conchae, in this area, we can see some features. Okay, what are the features? Let us see. What are the connections? We know it very well. In front, it is communicating with the nasal cavity with this posterior nasal apertures. What are posterior nasal apertures called as? Choanae. Okay, when we are doing cranial cavity, the osteology, I have told you this point. Posterior nasal apertures are called as choanae. Okay, through posterior nasal apertures or choanae, this cavity, nasal cavity, continues as nasopharynx. Okay. Now in nasopharynx, what else we can see? We can see that at the lower end of the nasopharynx, this is the palate. Okay. So we have hard palate and soft palate. The soft palate is the area which is filled with soft palate muscles. Okay. And this soft palate can be pulled back. Okay. Pulled back and gets in close attachment or connection with the posterior pharyngeal wall. Okay. And then obstruct the passage from the nasopharynx to the oropharynx. Usually this happens when we are having deglutition. Deglutition means when we are swallowing. When we are swallowing, what happens? The tongue pushes the food upwards and the food is passed downwards into the oropharynx. At this particular time, what is happening? The soft palate moves upwards and closes the narrow region which connects the nasopharynx with the oropharynx. This is called as, this narrow region is called as nasopharyngeal isthmus. Okay, what is it called as? Nasopharyngeal isthmus. Isthmus means narrow region. Now look at this. What are the features? What we can see in nasopharynx, we can see there is an opening opening is called as eustachian tube. Okay, this is the eustachian tube or auditory tube. Auditory tube, we know already that auditory tube connects the nasopharynx with the middle ear cavity. Okay, so there is a passage through it. So this is the auditory tube opening, and what we are looking at is the pharyngeal. This is the cartilaginous part of the auditory tube. Okay, this is the cartilaginous part of the auditory tube. So what we can see is there is a passage through which we can connect the nasopharynx with the middle ear cavity, and this passage is called as eustachian tube or auditory tube. Auditory tube has got two parts. What are the two parts? We have got cartilaginous part and the this is the cartilaginous part and the bony part. Bony part is towards the middle ear, and the one which is raised elevation, what we can see, is called as cartilaginous part. Okay, so this is the opening. Now when there, what we can see, if there is an opening, there is a raised margin here. What is this raised margin called as? Here we can see that there is an elevation, tubal elevation. Okay, tubal elevation. This is called as tubal elevation. So that means this is the auditory tube. Excuse me. This is the auditory tube, and above the auditory tube we have got tubal elevation. Okay, so what is this tubal elevation? Important. In tubal elevation is important because in this we have got a specialized lymphatic tissue called as tubal tonsil. So where is the tubal tonsil? Tubal tonsil is present on the tubal elevation. So on both sides, that means we are looking only at the one side of the nasopharynx. The other side of the nasopharynx has got another tubal elevation, and tubal elevation, both sides has got a tubal tonsil. We already discussed when we are talking about tonsil. Okay, tonsil means we had seen that group of lymphatic follicles. So these are two called as tubal tonsils. Okay. Then we also have got roof of the nasopharynx. On the roof of the nasopharynx, again we have got tissue, which is again specialized lymphatic tissue together accumulated, which is called as pharyngeal tonsil. Okay, what is it called as? Pharyngeal tonsil. On both sides we have tubal tonsil, above we have got pharyngeal tonsil. So that means on the roof we have pharyngeal tonsil, both sides tubal tonsils. Excuse me 1 second, please. Yeah, so we can see that these are the two tonsils which are seen in the nasopharynx. Now what are the other features we can see? If there is an elevation, okay, there is an elevation, we can see that the elevation continues. There is a mucosal fold here. See here, there is a mucosal fold which continues. We can see all these features in the dissection hall. We will try to show that features in the dissection hall. If not possible, we will record the videos and we will send you. Okay, so see here, this elevation, this mucosal fold is called as salpingopharyngeal fold. What is it called as? Salpingopharyngeal fold. Salpinx refers to the auditory tube. The fold of mucous membrane which is coming from the auditory tube into the pharynx is called as salpingopharyngeal fold. Okay, there is a small muscle which is present inside, which is called as salpingopharyngeus. Okay, so these are the important features. And behind the salpingopharyngeal fold, we have a small depression here. If there is an elevation in the front, behind what is that? There is a depression. So in this depression is called as pharyngeal recess. What is it called as? Pharyngeal recess. Okay. So these are the important features what we will see in the nasopharynx. Okay. Once again, we will revise what are the features in nasopharynx. We'll see auditory tube. This is the cartilaginous part of the auditory tube extending into the nasopharynx, which connects the nasopharyngeal cavity with the auditory tube. Then there is a tubal elevation. This elevation is called as tubal elevation. Tubal elevation continues downwards as a fold of mucous membrane, which is called as salpingopharyngeal fold. This salpingopharyngeal fold contains one more thin small muscle, which is called as salpingopharyngeus. Okay. Then what else we can see? We can see tonsils at the roof pharyngeal tonsil, on both sides tubal tonsil in the tubal elevation. Okay. So behind salpingopharyngeal fold, we can see a depression which is called as pharyngeal recess. So all this constitute together with nasopharynx. Now let us look at oropharynx. In oropharynx, what features we will see? We will see that anteriorly there is an raised elevation which is called as palatoglossal arch from the palate to the tongue. Okay, there is an raised elevation which is called as palatoglossal arch. Okay, from the palate to the pharynx, we have another raised elevation, mucous membrane only. Okay, so this raised elevation is called as palatopharyngeal arch. So two arches, what are these two called as? Palatoglossal arch, palatopharyngeal arch. Okay, in these two elevations inside, if you dissect this mucous membrane and see, we have two muscles inside. What are the two muscles? Palatoglossus and palatopharyngeus. Okay, palatoglossus and palatopharyngeus. So these are the two elevations of mucous membrane we will see, which are extending from the palate to the tongue and pharynx respectively. Between these two, what we can see? We can see a good depression which is called as tonsillar fossa. Okay, what is this region called as? Tonsillar fossa. What does the tonsillar fossa contains? Palatine tonsil. Okay, what does this area contain? Palatine tonsil. We have drawn histology of palatine tonsil, if you remember. So this is a palatine tonsil which can be seen between the two arches. Now below that, what we can see? This is the tongue. Posterior, anterior 2/3 of the tongue and posterior 1/3 of the tongue. In the posterior 1/3 of the tongue, you can see that this is all, the surface is rough. Okay, we can see that entire tongue surface is having nodular appearance. So this nodular appearance contains lymphatic follicles inside. Okay, and this area is called as lingual tonsil. What is it called as? Lingual tonsil. So all of these tonsils, see here from nasopharynx to oropharynx, there is a circle of tonsils. Okay, what are the circle of tonsils? We will just try to make the circle of tonsils. Okay. Above we have got pharyngeal tonsil. On both sides lingual tonsil. Okay. We have got palatine tonsils. Both sides palatine tonsils. And below that we have got lingual tonsil. Okay. So there is a circle like this. This is called as Walder's lymphatic ring. Okay. Walder's lymphatic ring. Where are the auditory tubes? Here are the auditory tubes. Palatine tonsils are here. So on the palatine tonsils, we have got tonsil, palatine tonsils. Okay. So here on the bottom, the tongue is present. So on the tongue, we have got lingual tonsils. Together, all this forms a Walder's lymphatic ring. Okay. It's a kind of ring which is seen on the nasal and oral cavities. See, this is the first line of protection from external environment into the interior. Okay, clear all of you? Did you understand what I am saying? Guys, everyone? Can you all hear me?
Yes, ma'am.
Okay. So these are the lymphatic areas which we will see in the nasopharynx and oropharynx. What else we can see? We can see when we enter inside, okay, behind the oropharynx. See, this isthmus is a very important area. What is this isthmus called as? Nasopharyngeal isthmus. This separates the nasopharynx from oropharynx. Okay, this is called as nasopharyngeal isthmus. When this will close? When we are degluting, when we are swallowing. So what do? You try to swallow and see. When you swallow, you cannot take breathe. Okay, so this is a defense mechanism which does not allow you to inhale air and swallow at the same time. Okay, so when you are swallowing, what happens? You will see that your nasal cavity is blocked. Okay, so this is the nasopharyngeal isthmus. How this nasopharyngeal isthmus functions: from the soft palate on both sides, we have a thin muscle. Okay, it's a part of palatopharyngeus muscle. It goes around and makes a circle. Okay, this is only half of the pharynx we are looking. So it goes around the posterior pharyngeal wall and comes back. So this part, slip of muscle, is called as Passavant's ridge. What is it called as? Passavant's ridge. Passavant, Passavant's ridge. Okay, so this ridge, what does it do? This muscle which is present inside, which muscle? The part of palatopharyngeus muscle which is present inside this Passavant's ridge will contract and constrict this nasopharyngeal isthmus. Okay, so that is a defense mechanism. And next, what happens, you see, when we are going to this region, when we are taking breath, what happens? Usually the tongue is mostly attached to the or closer to the soft palate. Okay, that means it is in the closed position. How the tongue, this region, the area between the oral cavity and the oropharyngeus or oropharynx junction is called as oropharyngeal isthmus. Okay, isthmus means narrow area. So this region is called as oropharyngeal isthmus. This is nasopharyngeal isthmus. This is oropharyngeal isthmus. In oropharyngeal isthmus will be closed usually when you are taking breath. Okay, so usually what happens when we do these two things together? When we will do these two things together, especially when we are eating, we try to talk. Okay, so what is talking? Breathing out the air from the larynx. So that means airflow is either going upwards or coming inside. At the same time you are eating. So what happens? Food particles by mistake can lodge into the larynx, go into the larynx and create a cough reflex. So we start coughing. Okay, so that's why what happens? That's why we when we are eating food, most probably we keep telling that we should not talk. Okay, so otherwise what happens? Any food particle can lodge into the larynx and can cause laryngeal cough reflex. Okay, so these are the features of oropharynx. Now look at this muscles which are going from the soft palate. So this is the salpingopharyngeus muscle. This is the palatopharyngeus muscle. Okay, it is going into the pharynx muscle. Okay, pharynx has got constrictors and dilators. Okay, so you can see that these are the ones which are present longitudinally, and these are the circular muscles. Circular muscles are called as superior constrictor, middle constrictor, and inferior constrictor muscles. Longitudinal muscles are salpingopharyngeus and palatopharyngeus. You can see from soft palate how this muscle is coming. Okay, from the auditory tube, cartilaginous part of the auditory tube, you can see that there is a thin slip of salpingopharyngeus muscle. Okay, so this is from back side. Okay, when we are looking from pharynx from the back side, what we can see, all the muscles are like cup shape. Okay, so how they are circular muscles, and this circular muscles, this is the pharynx. Okay, this is the pharynx together, total. And now this pharynx, we are looking from the back side. So circular muscles are present in a cup shaped manner. You see this one? This is the first constrictor that is sitting inside another cup, which is the next cup, middle constrictor muscle. And this is sitting in another cup. This is the third cup, that is the inferior constrictor muscle. So there are three constrictor muscles which are present, which are the circular muscles of the pharynx. How they are attached, you see here. I will tell you about these attachments in the next coming slides. Now, if you take out a section, okay, what we are doing? We are cutting from the back side, opening it and looking into the pharynx from back side. Okay, so see here, we made a slice, we cut down and opened it, and we are looking into the pharynx from back side. This is the nasopharynx. Okay, this is the oropharynx. You can see the tongue here, and this is the laryngopharynx. Okay, in laryngopharynx, what we can see in front, we can see larynx, inlet of the larynx. Inlet of the larynx is a very important area. Okay, what we can see in front, epiglottis we can see laryngeal cartilages, okay, which is called as cricoform and cuneiform. Okay, We have arytenoid cartilage, cuneiform cartilage, okay, cricoid cartilage. So all these cartilages are the cartilages of the larynx. Okay, so from the cartilages, arytenoid, cuneiform, we have a membrane which goes to the epiglottis, which is called as aryepiglottic fold. On both sides, we have got aryepiglottic fold. So these two aryepiglottic folds and the arytenoid cartilages on the back side and epiglottis on the front. So all together form inlet of the larynx. So while swallowing food, this inlet has to be closed, right? Your breathing has to be stopped while swallowing. So what happens? One, nasopharyngeal isthmus will be closed. At the same time, when you're eating food, food should not enter into the windpipe. Larynx, it should not enter. So what happens? These two aryepiglottic folds come together and close like a flap. Okay, epiglottis will not fall back. Remember that. Epiglottis will not fall back like a lid. No, it will be closed by approximation of aryepiglottic folds medially and shuts down like a flap. And then the food enters into the laryngopharynx. Okay, so this is called as deglutition process. You will have to write. That means in deglutition process, there are stages, stage 1, stage 2, stage 3. So this is how the food passes. Okay, what are the other features you will see in the laryngopharynx? In front, we have inlet of the larynx. And we have got cartilages of the larynx. And next to that, we will see this region. There is a nice space here. Okay, between the thyroid cartilage outside and laryngeal cartilage inside. Okay, between these two, we have a nice pouch-like space. This is called as pyriform fossa. What is it called as? Pyriform fossa. We can see all these structures in the dissection hall. And in vivas, very importantly, these all things can be asked. Okay, in viva, these all things can be asked. So you should know at least these questions in detail. Okay, so what can be asked? Pyriform fossa. This pyriform fossa is also called as smuggler's pouch. Why it is called as smuggler's pouch? Because it is believed that smugglers used to smuggle diamonds, keeping in this pyriform fossa and bring them to different regions later on. Okay, I don't know how they keep inside and how they take it outside, but this space is present on either side of the larynx, and this is called as pyriform fossa or smuggler's pouch. Okay, so these are the features of the three pharyngeal aspects, that is nasopharynx, oropharynx, and laryngopharynx. So this is the same thing in a better picture. We can see nasopharynx. We are looking from the back side. See, we made a cut here. We opened the pharynx and we are looking from the back. Okay, nasopharynx, oropharynx. Here we can see the tongue, soft palate, and on both sides palate, we can see that this is the epiglottis, aryepiglottic fold. Okay, these are the cartilages of the larynx, cuneiform and corniculate cartilages, arytenoid cartilage, and cricoid cartilage. Outside we have got thyroid cartilage. So between these two, nice depression is present. This is called as pyriform recess. Okay, what is it called as? Pyriform recess. So these are the features of larynx. Already we discussed about Walder's lymphatic ring. As see here, what is palatine tonsils? This is a tonsillitis. Picture showing tonsillitis. You can see that inflammation and infection of the tonsils can cause pus formation in the tonsils. You can see the soft palate. We are looking from the oral cavity. This is the tongue. Okay, palatoglossal arch can be seen here, and you can see this another arch. This is the palatopharyngeal arch. Between the two arches is the tonsillar fossa, and these are the tonsils. Even when we open our mouth and see in front of the mirror, pull out the tongue and see, we can see the tonsils between the two arches. So if they are inflamed, you can see more swollen. Easily we can see swollen tonsils. Okay, but tonsillitis, inflammation is tonsils common, but infection of the tonsils can lead to severe throat infection and pain while swallowing. Okay, so we do a tonsillectomy. Ectomy means removal of tonsil. Okay, so when you are removing the tonsils, what is there behind the tonsils? We have got blood vessels, tonsillar branch of ascending palatine artery, tonsillar branch of facial artery are present deep to the tonsils. So first, before removing the tonsils, we'll have to ligate these blood vessels and then remove them. Otherwise, what happens? It might injure, it might cause severe hemorrhage. Okay, and we'll also have to remember that behind the tonsil bed, tonsillar bed, we say, behind the tonsillar bed we get glossopharyngeal ka tonsillar branch. Okay, tonsillar branch of glossopharyngeal nerve. So if we are doing tonsillectomy, we'll have to ensure that we are not injuring these structures while removing tonsils. Now this is called as quinsy. Quinsy is again an inflammation and almost obstruction of oropharyngeal isthmus. You can see that the tonsils are very much swollen. Okay, and the oropharyngeal isthmus is completely blocked by the enlarged tonsils and closure of oropharyngeal isthmus with an adhesion of the soft palate to the fosses. These are called as what are fosses? Nothing but palatoglossal arch and palatopharyngeal arch. You can see that palatoglossal and palatopharyngeal arches both are swollen here and they close the area. Okay, they close the area oropharyngeal isthmus. This situation is called as quinsy. Now these are called as adenoids. What are adenoids? When tonsils in the nasal cavity. Nasal cavity also we have got, right? Pharyngeal tonsil, okay, tubal tonsils. This is the view from the nose. When we look from the nose, when those tonsils are swollen, we will see adenoids. Okay, so adenoid means what? Inflammation or infection of nasal and pharyngeal tonsils. Okay, inflammation of palatine tonsil, we call it as tonsillitis. Make sure you remember these names. Okay, so what is the nerve supply? Nerve supply of nasopharynx is by the maxillary nerve, oropharynx is by the glossopharyngeal nerve, and laryngopharynx is by internal laryngeal branch of the vagus. Okay, so these are the three areas which you will have to remember. Blood supply, whatever areas, whichever blood vessels are supplying to the anterior aspect, that is ascending pharyngeal, tonsillar branches of facial artery, branches of maxillary and lingual arteries. Okay, just oral cavity, you get lingual artery. Okay, maxillary artery. So these are supplying the laryngopharynx. Okay, nasopharynx, facial artery, tonsillar branches, ascending pharyngeal branches of external carotid. So these all will supply the pharynx. Lymphatic drainage, deep cervical lymph nodes and retropharyngeal lymph nodes. Just keep that in mind. You'll have to mention the lymphatic drainage whenever you have to write this question. Okay, this is the lymphatic drainage. Now let us see the muscles. As muscle attachments are very important. We have three constrictor muscles. What are the three constrictors? Superior constrictor, middle constrictor, and inferior constrictor. Okay, what is its origin? Superior constrictor takes origin, it is in an order. Okay, you see this, how it is taking origin. It takes origin from the base. We have a membrane here from the tympanic plate of the temporal bone and the pterygoid hamulus. Okay, so from there is a ligament joining these two. From that ligament it takes origin, and it takes origin from pterygomandibular raphe. Okay, it's very easy to draw this diagram. If you understand and draw the diagram, it's very easy to write origin and insertion. So just make sure you draw a simple diagram drawing the origin and insertion. Okay, so where it takes origin from tympanic plate and the pterygoid hamulus, pterygomandibular raphe, and the mandible. Okay, ramus of the mandible. This is the superior constrictor origin. Now look at the middle constrictor origin. This is what? Styloid process. From the styloid to hyoid bone, we have stylohyoid ligament. Okay, so inferior end of the stylohyoid ligament, and see here body and greater cornu of the hyoid bone. Okay, so this is the origin of middle constrictor muscle. Inferior constrictor is coming from where? This is the thyroid cartilage. From the lamina of thyroid cartilage, okay, thyrocricoid membrane from the arch of the cricoid cartilage. Okay, so from all this region, it takes origin, inferior constrictor muscle. So inferior constrictor has got two parts, the one which is coming from thyroid and the other part is from the cricoid. So this is called as thyropharyngeus muscle and this is called as cricopharyngeus muscle. Both are part of inferior constrictors. So this is the origin of all these muscles. Where it is going for insertion, all these muscles go backwards and get inserted to the fibrous raphe. This is called as pharyngeal raphe. Where is this pharyngeal raphe? See here, it is attached to the base of the basi-occiput. Okay, basilar part of the occipital bone. Pharyngeal tubercle is there. Okay, so there this pharyngeal raphe is attached. Okay, so to that all the muscles are attached in a cup-shaped manner, one inside the other. Okay, this is the insertion of all the muscles, right? Then what else we have? Dilator muscles. See here, stylopharyngeus and salpingopharyngeus. We already discussed this. Okay, stylopharyngeus joins with the inferior constrictor and middle constrictor, whereas salpingopharyngeus goes inside and joins with the superior constrictor muscle. Okay, so these are the all the muscles of the nasopharynx, oropharynx, and laryngopharynx. This is the salpingopharyngeus and palatopharyngeus from front. Palatopharyngeus, we cannot see it in the previous picture. Okay, but here what we can see is stylopharyngeus muscle. Here we can see salpingopharyngeus and palatopharyngeus. So three muscles we have seen as constrictors and three muscles are longitudinal muscles. You'll have to write origin, insertion, nerve supply and action of these muscles. So this is one table which is very, very important. Okay, if it is possible, take a screenshot and keep it with you. Because this can be asked for your vivas. This can be asked from, at different points, they will ask you, okay, what are the muscles, nerve supply of muscles of the pharynx? All muscles are supplied by pharyngeal plexus, except there is an exception, stylopharyngeus, which is supplied by glossopharyngeal nerve. Same with the palate. All muscles are supplied by pharyngeal plexus, except tensor valley palatini, which is supplied by nerve to medial pterygoid. Tongue, all muscles are supplied by hypoglossal nerve, except palatoglossus, supplied by pharyngeal plexus. Okay, wherever pharyngeal plexus is coming, that is actually accessory nerve. Okay, cranial part of the accessory nerve supplying through vagus. Okay, so like that. Facial expression, all the muscles are supplied by facial nerve except levator palpebrae superioris. So these exceptions are important. So take a picture and keep it with you. This can be useful at the end later on. That's all. This completes the pharynx. I want you all to join back. In 15 minutes, we will complete histology demonstration. Okay. We have to do central nervous system histology and excretory system we will finish today. So I want you all to join back. Before that, there is very important announcement. Okay, we don't have time for taking your seminars. So what I want you all to do is, every one of you get 5 minutes time. Okay, 5 minutes time. You prepare whatever topic you want. It's okay, we are giving freedom to you. You can pick the topic on yourself, present it, record the presentation and upload it in the Google Classroom. Okay, clear everyone? Everyone?
Yes, ma'am. Yes, ma'am.
Okay, so I'm giving time till next Monday. Okay, that means coming Monday. By Monday, I will upload the link today itself. Okay, any topic you prepare, make a 5-minute presentation and you present it. Record the presentation along with your video. Okay, record the presentation with your video and send the recording in Google Classroom. Any doubts here?
Ma'am, can the topics be repeated?
Topics, your choice. No problem at all. Okay, we are giving that freedom. Fine. Even if the topics are repeated, it's okay. Okay, because everyone are doing their own ways here. Okay, we will evaluate based on your topics uploaded. Okay, how you are presenting. Clear?
Yes, ma'am.
Right. Okay, and join back now.